Steroid. Published by WordPress.com. Use of steroids in orthopedic disorders. Steroids, particularly corticosteroids, are commonly used in the management of various orthopedic disorders to reduce inflammation, control pain, and improve function. However, their use must be carefully considered due to potential side effects, especially with long-term use. 1. Indications for steroid use in orthopedic disorders. Inflammatory joint diseases. Rheumatoid arthritis, RA. Steroids help in controlling flare-ups, reducing inflammation, and managing pain in the joints. Osteoarthritis, OA. Steroids are used in cases of severe inflammation when other treatments are not effective. Gout. Corticosteroids can be effective in controlling acute inflammation during gout attacks. Soft tissue inflammation. Bursitis. Inflammation of the bursae, especially in the shoulder, hip, or knee, can be treated with corticosteroid injections. Tendinitis, tenosynovitis. In conditions like rotator cuff tendinitis, patellar tendinitis, or Achilles tendinitis, corticosteroid injections can provide significant pain relief and reduce inflammation. Spinal disorders. Radiculopathy, nerve root irritation. Steroid injections are often used in conditions such as herniated discs or spinal stenosis to reduce nerve inflammation and alleviate pain. Cervical or lumbar spine pain. Epidural steroid injections may be used to treat radicular pain caused by conditions such as disc herniation or spinal stenosis. Traumatic injuries. Sprains, strains. Short-term steroid use can be helpful in managing pain and inflammation following ligament sprains or muscle strains. Post-surgical inflammation. After orthopedic surgeries, corticosteroids can be used to control inflammation and promote healing, particularly in joint replacement surgeries. 2. Routes of administration. Oral steroids. Prednisone or methylprednisolone may be prescribed for systemic treatment of inflammatory rheumatological conditions. Intraticular, joint, injections. Steroids are directly injected into the affected joint for localized relief, often used for arthritis, bursitis, or tendinitis. Epidural injections. Steroids are injected into the epidural space in the spine to treat conditions like radiculopathy and sciatica. Soft tissue injections. Injections into the soft tissues surrounding joints, tendons, or ligaments, such as the shoulder, hip, or knee, to reduce inflammation and pain. 3. Benefits of steroid use in orthopedic disorders. Pain relief. Steroids are highly effective in reducing pain caused by inflammation in joints, tendons, and muscles. Reduced inflammation. Corticosteroids quickly suppress inflammation, which helps in conditions like arthritis, bursitis, and tendinitis. Improved function. Steroid treatment can improve range of motion and joint function by decreasing swelling and pain. 4. Side effects and risks of long-term steroid use. Osteoporosis. Long-term steroid use can lead to bone loss and an increased risk of fractures. Avascular necrosis, AVN. Prolonged steroid use, especially in high doses, can contribute to AVN, particularly in weight-bearing joints like the hip. Joint damage. Repeated steroid injections into joints can lead to cartilage damage over time. Infection risk. Intra-articular injections can increase the risk of joint infections. Skin and soft tissue effects. Steroid injections may cause thinning of the skin or localized fat atrophy. Metabolic effects. Long-term systemic steroid use can lead to elevated blood sugar levels, weight gain, and other systemic side effects like hypertension. 5. Precautions and considerations. Dose and duration. Steroid treatment should be used at the lowest effective dose for the shortest duration possible to minimize side effects. Frequency of injections. Limiting the frequency of steroid injections into joints or soft tissues is important to avoid potential damage. Monitor for side effects. Patients on long-term steroid therapy should be monitored for side effects such as osteoporosis, infections, and metabolic disturbances. Alternatives. For chronic conditions, non-steroidal anti-inflammatory drugs, NSAIDs, physical therapy, and other non-invasive treatments should be considered as alternatives or adjuncts to steroid use. Steroids can be highly beneficial in the short-term management of orthopedic disorders, especially for reducing pain and inflammation. However, their long-term use requires careful management to avoid significant complications like osteoporosis, joint damage, and increased infection risk. Proper patient selection, dose adjustment, and monitoring are critical to maximizing the benefits while minimizing risks.